is Sydney.
And we are presenting puppy diseases! Woo! Hello everyone, and thanks for having me here today to talk about canine distemper virus. Let's first start off with who gets it. So usually it's only young, unvaccinated puppies raised in less than ideal environments such as puppy mills, poor neighborhoods, or shelters, as well as stressed or immunosuppressed dogs that can get it as well. So basically the young and the vulnerable. Let's go on to how they get it. So they can get it from asymptomatic dogs as well as sick and recovering ones as well. Also, wildlife hosts can carry it, such as raccoons and coyotes. Recovered dogs, so dogs that have already had it and are in recovery, can shed the virus for up to 10 to 14 days. It is transmitted in the air, so aerosol route, which means that they inhale it and it gets into their lungs. Onto their response. So once they have inhaled it and it is in their body, it replicates in the lymphoid tissues, which are tissues of the immune system, such as the white blood cells, spleen, lymph nodes, and bone marrow. It usually takes 10 to 14 days, but then it invades the central nervous system, which are the most common clinical signs that we will see. Pretty much they can respond either fast, slow, weak, or not at all. And how quickly they respond will later dictate how the virus progresses in their body. So if they have a fast response, they'll be able to clear it quicker than if they have no response, where it will progress to our more fatal and severe clinical signs. So our clinical signs. So most dogs will actually be asymptomatic, so they will show no symptoms. But the ones that do show symptoms will usually have nasal discharge and sneezing, which can progress to pneumonia, vomiting and diarrhea, as well as on their foot pads and their nose skin. It'll get thickened and hard, which we call hard pad syndrome. We can also look in their mouth. We can look at their enamel and see that the enamel will be underdeveloped and thin. We can check for lymphopenia. Yes.
What is lymphopenia?
Right, sorry. Lymphopenia is a decrease in the number of lymphocytes that we see, and lymphocytes are a type of the white blood cells that we, as well as dogs and cats, have in our bodies. We can also tap their cerebrospinal fluid, which when we look at it could be normal, or it may show elevated protein and an increase of mononucleated cells, which is indicative of viral encephalitis. Yes!
What is viral encephalitis?
Viral encephalitis is basically inflammation of the brain that we can see when we tap this fluid. A final test that we can perform is testing for the viral antigen on their skin, foot pads, or in that spinal fluid that we have just tapped for. That is everything. Does anyone have any questions? Yes.
So once you know that they have this virus, like, what do you do? How do you treat it? Like, is there anything you can do?
Unfortunately, there isn't a whole lot that we can do. Our treatment is mostly supportive and non-specific. So we can treat the clinical signs that they do have if they're dehydrated, make sure that they're eating, try and stop the vomiting or the diarrhea in whatever way that we can, but pretty much the prognosis for this disease is not very good once those neurologic signs start showing up, because those are generally lead to the more fatal parts, as well as the seizures that generally come with this virus are very hard to control. Yes.
So if it's so bad once they have it, like, what can you do to avoid it?
Pretty much the only way you can avoid it is vaccinate, vaccinate, vaccinate. You want to make sure to vaccinate your puppy when they are 6 to 8 weeks old, as well as do that booster for every 3 to 4 weeks until they have their full dose. After that, the adults only need 1 dose a year, and that is the best way that we can prevent this virus in our dogs. Thank you all for having me.
Hi everyone, so just following up on what Sydney was talking about puppy diseases, we also need to talk about parvovirus. So parvovirus is generally affects puppies between 6 to 14 weeks of age. And we generally see it in puppies that come from kennels, pet stores, shelters where they've been in close contact together. Rottweilers, Doberman Pinschers, and Pit Bulls are generally more genetically susceptible, but it's a very infectious disease, so it's very easy for any animal to get it. It's a fecal-oral transmission. However, it is stable in the environment for up to a year, so even a vaccinated animal can be exposed and contract the virus. It's very resistant to disinfectants as well. Clinical signs generally look like vomiting, bloody diarrhea. Yeah, question.
Why do we see bloody diarrhea?
So the way the virus works is it attacks fast multiplying cells. So one of those fast multiplying cells is in your intestinal villi. So as that gets destroyed, you're going to see blood passing through in the stool. So vomiting, bloody diarrhea, we're going to see fever, depression, anorexia, so that GI symptoms just get worse. Dehydration, shock, and death can occur if the disease is not treated promptly. Question?
What's the actual mortality rate for these infected animals?
So parvovirus, even if we do hop on top of it right away, it can be up to 60% mortality. So yeah, it's nothing to sneeze at. So if your dog is vomiting or has diarrhea, get it checked out. So how do we decide if your vomiting and diarrhea having puppy is actually parvo positive? We will generally do some blood work. So we're going to look for anemia, so that's going to be from the blood loss. We're also going to look for leukopenia. Yeah, question?
What's leukopenia?
So leukopenia just means low numbers of white blood cells. So the system is getting overloaded from this virus. The white blood cells are doing their best, but it's just too much for their immune system, so they're getting immunocompromised. So there's a fecal test. You can do a SNAP test that's going to look for the antigen or the actual virus. However, it's not the most reliable test in the world. So prevention, the best thing that you can do is vaccinate. So once your puppy has hit 6 to 8 weeks of age, you're going to start vaccinating them every 3 to 4 weeks until they hit 14 to 16 weeks. And then after that, you're going to want to revaccinate your dog every 3 years just to help prevent this virus. So, are there any other questions? No? All right, perfect. Thanks for having me.
I can't do it. I can't do it. Ah!
Don't ask me what that is. I should look that up.
I didn't even know what it was. Why do I swear so much?
Okay. Just explain what a cerebral spinal tap is.
No, Lauren, I don't know what it is.
They hit 14 to 16 weeks.
There it is! Oh, thank God!
Sydney.
No, answer it. Go, on the spot, right now. What is it?
I told you what an antigen is.
Are you sure?
Yes, you weren't listening. Oh my word.
I'm a bad listener.
Worst audience ever.
Yeah, I know. I'm sure.
Oh
Oh my God. Diseases! What?